are you?
My name is Romeo Lagutino. I've been a nurse for about 12 years now. I'm from Ontario, well, born and raised in the Philippines, and then from Ontario. And then I moved here 4 years ago now. I've been a nurse for 12 years. I work in several emergency departments in British Columbia and as well as in Ontario. I did all my educations in Ontario, and then I moved here, and in I worked in post anesthetic care unit for the past 3 years, and I started working as an instructor here in Camosun for 2 years, and here we are.
So what is your position at Camosun?
I'm a nursing instructor for the BSN program here at Camosun, and my continuing faculty.
Why did you decide to teach nursing?
I think I'm at the point in my career that I need to venture out on other fields of nursing. That's the beauty about nursing. There's so many things, there's so many open doors for everybody, there's always something for everybody. So I feel like education is something that I've always wanted to go into. It just fills my cup, like teaching students and kind of sharing the knowledge and my experiences in clinical setting. It fulfills me as a person. So I've been loving it for the past 2 years, and I think this is where my career is going.
What initially sparked your interest in the field of nursing?
As a Filipino, I think it's kind of natural for us to be nurturing and hospitable and helping out, like helping out people. And combination of me being love sciences and just humanity, and with those combination, I think I thought of I think nursing would be a perfect fit for me. And it's obviously been a long road, and there was ups and downs in my career, but I found where I wanted to be at in terms of nursing field. And
What was your schooling like?
Okay, so I started my diploma in nursing in 2010, and that was about for 2 years. After that, I started working as an LPN, or registered practical nurse, in Ontario. So I worked for I think 5 years. While doing that, I went to do my bridging program in Ontario as well. So that was 1 year. And then I did my BSN program, so that took me another 3 years part-time. So it's a bit of a long pathway, but I think it was worth it. Just kind of opened a lot of doors for me in terms of going to the RN program. I was able to get into critical care,
What does interprofessional collaboration mean to you?
So in healthcare setting, interprofessional collaboration means that every member of the team has something to bring to the table. And it's a team environment, so everyone works for a common goal. And that is for patient safety, increase patient positive experiences, positive outcomes with patients. So getting them better as fast as we could, so they don't have to be in the hospital setting for longer. So interprofessional collaboration is that concept that's so important in healthcare, that we need to work together as a team for the patient, because it's all about patient-centered care, it's all about holistic care, and that's interprofessional collaboration for me.
How have you seen IDE develop over the years? What worked and what didn't work?
For me personally, I have not seen it kind of integrated in my schooling back in Ontario. I feel like that wasn't really highlighted in my schooling. I knew that was important, but I feel like it wasn't really included in our curriculum, both schools that I've been to. And coming here to Camosun to teach, and it's great that we have this, that it's highlighted in every field of kind of like every program of the health and sciences kind of come together and do these activities, which is great because that's how we simulate interprofessional collaboration, and this is how we get students to work together, and this because this is what we will do in that this is what they will do in the future. So it's great that they're doing these things now, and it's great that we have more awareness of it as the time, yeah, kind of over the years. So there's more awareness.
In your experience, what are some of the common barriers to effective interprofessional collaboration, and how can they be overcome?
That's a tough question. I feel like communication for sure. Lack of communication it's obviously a hindrance, or it kind of hinder us from having that collaborative effort. Kind of like role clarity as well. If we don't know what each other members' role and responsibilities, then we don't necessarily know what resources we have. If, for example, like social work, they are there for us to help us with terms of like housing, if the patient needs like support with finances, housing, resources in the community that they could help out. If a nurse or another allied health team member is not aware of that, then it's hard for them to get those resources because they are not aware of it. So it's great to have that knowledge of the roles and responsibilities of each team member in the professional team.
What is the significance of timely and accurate laboratory results in the management of your patients?
Oh my gosh, it's huge. I mean, I'm from emergency department. I worked in emergency department for 6 years. So timely results, I mean, results that are timely, time sensitive, it's huge, right? Like this, because as soon as we need to get the results as fast as we can. In ideal world, to to integrate or to implement those interventions that we need to be. For example, like if a patient is having a stroke, we want them to have a CAT scan right away, and we need to get the CAT scan report back right away, or someone could read it right away. It's resulted, and then we can figure out what the game plan or what we need to do to help that patient, right? Because for a stroke, especially for ischemic stroke, we only have a limited time to give important medication. It's called thrombolytic. It's going to dissolve the blood, and you can only give, I think, the time frame is like about 4 to 5 hours, and we only have that time frame. So it's so huge that we have to have that in a timely manner, for sure.
Have you seen situations where poor phlebotomy created problems with patient diagnosis or treatment?
Not specifically. I feel like nurses, phlebotomies, or like lab technicians, they're kind of really cautious of if like a lab result is not accurate. I mean, for example, if it's like a potassium is hemolyzed, they're kind of like, okay, they report it to the nurse, but also critically thinking about what might be the reason that is hemolyzed, right? What are some reasons? I don't know. I see it a lot with like cancer patients, and I forget the rationale behind it, but that's one of them. So yeah, I think usually what happens if it's too high or critical of a number, and it depends on how the patient is presenting. If it makes sense, right, we kind of go to like we trust that value. But if it doesn't make sense, if the patient's not presenting the way the value is saying us, that kind of guide us to kind of do the blood work again, which is not wrong, right? Because we want to make sure that it's accurate as possible. Yeah.
How can we as MLAs better communicate the importance and impact of our work to other healthcare professionals?
I think it's not any, it's not particular. I don't think it's particularly just for us CMLAs. I think it's for everybody, just kind of like really communicating clearly to the nurses what you guys are doing, kind of giving that open communication really. When you come up to the floor, make sure that obviously if we need to be aware that you guys are there because of labs, that we need to be aware of the values, then we probably want to know that you are there, so you're physically there and taking it. Yeah, just kind of open communication for sure. And if you have also the same way, right? If you have any questions, don't feel bad of asking those questions to the nurses, because it's all about patient safety, right? And just timely communication, I think it's really important. Like obviously in terms of critical values, lab values, we want to know that right away, and you guys are really great at it. You guys call us and make sure that we are aware of the critical value, and you actually get like a initials from us, which is great to kind of document that you guys have given and conveyed us that critical value.
If you had to be a different type of nurse, which specialty would you have chosen?
So I've been in Emerge for 6 years. I did med surg for about 5, and then 3 years in post anesthetic recovery. I feel like I would want to do traveling. So like I was a travel nurse for 2 years in BC, but it was just over the province. I want to do something like maybe like Doctors Without Borders. Something like overseas, or maybe a cruise ship nurse. That'll be exciting because I would like travel a lot. So I think if I put those kind of together, it'd be like best of both worlds, seeing another country, another culture, but also helping people and getting them better, and helping the communities that they need it the most. So I think that's could be something.
What is one thing you wish you had learned in nursing school?
That it is not going to be an easy, journey, that you will have really tough times, and I wish that someone told me that I needed those people to guide me and to mentor me, because I think like mentorship is so important. I think it's not just for nursing, I think it's for every field. Because as a new nurse, it's so tough out there, working on your own, having your own patient load. I think if you can get mentorship from people that you can trust, that could guide you and could give you helping hands when it gets tough, right? And yeah, it's really that mentorship with one nurse to another, and that I think that's it.
What is one piece of advice you want to give to your students?
That nursing is such a huge, field, that everyone will have their own kind of field that they will fit into, and don't be discouraged to try something and not like it. Try everything. You just never know what you will fulfills you as a nurse. And until then, if you don't try it, and you don't really know how it is like. So I feel like expose yourself to everything, because it will always going to be learning. You're always going to be learning in your career, and yeah, that's it.
Yeah, perfect. That's all we have.
Oh, that's it?
Yeah.